Good morning, viewers at home and around the world. We're happy to be back this morning on Health Matta. And with me today is a consultant psychiatrist, addiction psychiatrist to be precise. She works with Neuropsychiatric Hospital Yaba by name, Dr. Jumoke Koyejo. Dr. Jumi, you're welcome.
Thank you very much.
So nice to be with you once again. You've been with us here a couple of times.
Yeah.
The time passed. Okay, so today we'll be talking about the new monster in town, methamphetamine, known by a number of street names, Mkpuru-mmiri. Some call it crystal, ice, crank, name them. The list is endless, I must tell you that. A good number of us must have seen a lot of trending videos and stories of youths whose lives may have been ruined because they resorted to taking some of these very addictive substances. In medicine, we refer to it as substance abuse. Okay, but it's becoming a big problem in our environment. It's a new monster in town. It's causing a lot of havoc. A lot of youth are taken to crimes. Stories are abound of people who took such drugs and afterwards they went back home, unleashed terror on their family members. Some even killed their parents. And of course, some of the communities responded by burning some of them alive. A whole lot about this monster. Okay, so this morning we'll be discussing methamphetamine. Okay? Now, what is it all about? And that is why we have a specialist in the building. While I was preparing for this topic, I was rattled when I saw a statistics that I got from United Nations Office on Drugs and Crime, that Nigeria has about 14.4% prevalence of drug or substance abuse. This is seen to be the highest globally. The global prevalence is about 5.5 or thereabout. So if I want to put it in a way a layman can capture it, Nigeria today is seen and regarded as the headquarters of drug abuse. That's not a good appellation. And with us today in the studio to do justice to this topic is a consultant addiction psychiatrist. So I'd like to yield the floor to her at this time to tell us what methamphetamine is all about. Thank you very much, ma. You have the floor.
Thank you very much, Dr. Bat, and I'm really pleased to be here today.
Thank you.
But permit me, because for me, I see this every day. And for me, it is not just about highs, crystal meth. So there are so many of these drugs.
Substance abuse.
Yes, there are several of them, and it's been a great monster in our midst. But let me just give us a brief background, because I think it's not just about Mkpuru-mmiri, or I hope I pronounced it well.
Yes, you did. Mkpuru-mmiri.
Yeah. Let me even tell us what these substances are, these substances of abuse are. They give people their desired pleasure. They are easy habit forming. They alter the way we feel. They alter our mood. They alter consciousness and behavior. And at the end, the most important thing about them is that they become the central point in that person's life. And they take over. It's like they hijack the functioning of the brain from that person. And that's the way I can explain this to the
Everything becomes secondary.
Everything becomes secondary. And it's, Donald Trump, I think in 2017, actually declared an opioid epidemic, it is something that we're just waiting for everybody to declare that there is fire on the mountain and there's need for all of us to run. It's not just about adults, children, it's across religious background and everything. So it's a big problem. And these things, I'm not going to talk about ice only.
Yes.
They're locally grown, cannabis, Indian hemp. You see them talking about Colorado, Pawpaw, Mali, Loud, and the rest. These are synthetic cannabis, very potent psychogenic substances. I mean, the risk of them causing psychosis is very high. That's, how would I say psychosis now?
No, you're doing
In a
well.
non-stigmatizing, because I won't, you know.
Yes, yes.
And
People that are mentally challenged.
yes, it brings so much psychotic, abnormal behavior. And and amphetamine too, it's one of them. It's very, very psychogenic. And these substances come from all over. And, you know, sometimes my patient would ask me, Dr. K, what's your problem? These things are legal, they are legal. Why are you telling us not to take? I'm telling you, the fact that some drugs are legal does not make them right to use. Okay, let me give you an example of Mkpuru-mmiri now. You can imagine a physician would prescribe 2 milligrams for ADHD, attention deficit activity disorder, methylphenidate for, you know, and you, yes, for treatment, and you are using like 500 milligrams because you want to be high, you want to feel among. And these are big problems. Even tobacco and alcohol. You know, I'd like to talk to us about concept of gateway drugs, because today we all know there's a problem. And there's need for everybody to act at this point in time. There is, and from homes to schools to the government. You know, when I talk to my patient and they tell me that they started using drugs from their parents' bars, those bars you have at home to show that you're a big man.
Wow.
When you serve that important guest that drink, the guy wants to feel important, so he goes to drink to feel that same way. And these are gateway drugs. You know, when you smoke in front of your child, you know that you are telling the child it is right to do. And there are several illicit substances, cocaine and the rest like that. So it's a big problem. And when I talk to people about substance, why some drugs are declared legal, they are socially acceptable. Because every day, my patients are very intelligent people, and they keep asking, Dr. K, go and relax, what's your problem? And I tell me that, sorry, what determines the legality of a substance is not based on how safe those substances are. Tradition, politics. Politicians want your vote. Economy. Some people want money. Religious reasons, culture. You know, the rave in town. Mkpuru-mmiri became a style, and they were all taking it. So these are things that we should all think of. And it's not just about...
What is unique about this methamphetamine? It seems to have taken over above drugs that we have known that people have been abusing over a period of years, decades, and what have you. What is it about methamphetamine? Does it have to do with the cost? Why is it
highly psychogenic?
Okay.
It is cheap.
That's highly addictive.
It is highly addictive,
okay.
Number one. It is cheap.
Wow.
They find it everywhere. You know, now they don't have to pay so much to get those things.
Okay.
Available,
not
accessible.
As expensive as cocaine
no,
and others.
Available.
Okay, we can see the picture. For those of us who may never have come across it, that is the picture on the screen at the moment. That's why they call it crystal, looking like eyes. Okay, that's the picture that we can see for those of us who may never have come across it. I haven't. I've only seen them on pictures.
I've not seen it.
Oh, it's amazing. Someone that deals with this on daily basis.
No, because they would, they won't even, they might not even allow to bring it to the world. So it's a big problem. And another thing I want us to see, comparing the Mkpuru-mmiri or the substance abuse pandemic and HIV, which one do you think is worse?
Well, I think this is beginning to take over, because at a point,
it has taken over a long time ago.
It is beginning to take over.
It has taken, it's not beginning, it has taken over a long time ago.
Because I sat back earlier this morning to do a calculation of what 14.4% using our Nigeria is known to be a country of about 200 to 250 million people. Okay, so I use a lower border. 200 million people, 14.4% of that, I was getting almost 28.8 million, close to 29 million. So that means this number of people are actively engaged in all forms of drug abuse in our nation.
Yes. Let me now tell you something. That 14.4 million you are getting is for people between the age of 15 and 59 years. So that means the active workforce. The people that are supposed to take the nation to the next level. And let me shock you again. Lagos State has 23% prevalence.
Wow. Wow. Wow.
So it's a big...
As against global prevalence
yes.
of about 5.5%.
Yes. That study you're talking about, I've read it through and through. So it's in my head. Lagos State has 23% prevalence. That means, what prevalence means is that number of people that are using. That means in every 100 people in Lagos State, if you take them randomly, 23 of them is using one substance of abuse or the other.
Now, how, with respect to methamphetamine, how is it used by individuals? What are the routes of usage? Or I don't want to say routes of drug administration because these are not the normal pharmaceutical drug that you and I use on in the clinic on a daily basis. Okay, so
let me sound a note of caution. We don't want to be suggesting things to people on this show.
Okay.
Because suggestibility is another problem. People that are quacks don't know. I've seen my patients say when these people came to our school to talk about substance abuse, the things they said even made me got interested, and I told myself I would use.
I never thought about that.
Suggestibility is something that we really have to be very careful about. So maybe we should leave that.
Okay.
I'm so sorry. But
I understand.
Suggestibility is another problem we have in town.
I quite agree with you. Now, let's look at how does it cause this degree of havoc? How does it affect the brain?
It is an highly psychogenic substance.
Okay.
Worse than some natural weed. Of course, Colorado too ranks high. Loud ranks high. Mali ranks high.
Which one is Mali? I beg your pardon. I know Mali is a nation in Africa.
These are...
Okay, we can see some of the pictures of people being people that are receiving treatment in quotes. Because we are still going to come to this.
I feel very bad when I see things like this. I feel very bad.
Wow.
Because this is a nation that all the experts are around, and this is not the treatment.
But can this ever be a solution?
It can never. Let me tell you something.
So the flogging that we are seeing, the torturing that we are seeing
of the
addicts.
They're treating themselves. They're not treating the patient.
Wow.
You've threatened them with death in some countries, and they still do. I've met someone that said, we just got talking, and he said, look, doctor, leave death alone. Where then they put others, make them put him.
Chai.
So death has never worked. So how will flogging work? No, look at it that way. Death, as if hung them, there was a time they were hanging substance use traffickers.
Yes.
It didn't stop them from so beating them. The community is just treating themselves, feeling that they are doing the right things. Let science lead. Let people that know. And
this will make them to go underground.
Definitely. It's not about flogging. It's about doing it right. You know, when I was coming, I was just thinking of something. In Anambra State, they have voted for a professor. So the consequences of voting a professor is school. These are the little things that would help. And when we are thinking about prevention, which I love to talk about, we think about prevention in terms of demand and supply. When there is no demand, there won't be supply.
What are the signs and symptoms that we can see among those people that abuse these drugs?
Yeah, thank you very much. Let's talk about ice, which is a stimulant.
Okay.
Initially, they think they're using it for positive purpose, to be awake, to lose weight, for, those basic things. But later, they realize they can't eat. They lose their appetite. They become hyperactive. And because the psychogenic organism, a chemical, it's the abnormal behavior sets in. You see them becoming very violent, taking irrational decisions. And the psychosis, they hear voices of people they can't see, they behave abnormally. These are basic things you see in them. A child that eats normally before is not losing appetite. Your child that is very calm, having so much energy. And these are things that we should watch out for in children. Well, let's extend it a bit about beyond Mkpuru-mmiri.
Yes.
When you see your child, the grades are dropping in school. A child that's always well-dressed now does not care about how he dresses. A child is becoming secretive. Please take a closer watch. because they might be using substances, becoming unduly brave. Something might be happening, you know.
It's not just children now. So our spouses should also watch us for their partners. No, it's true. They should watch us for their partners when when we start seeing these strange behaviors. Because I do know that a good number of people that I know that have been affected, they don't know where their business is anymore. They are not concerned again about what is going on. Okay, so they are more or less taken away from their normal source of livelihood. Everything they do, the businesses will crumble, and it affects, just like you said, virtually everything about the person. So
well,
not
when
just
I was defining, I told you that it hijacks the brain. There's this picture that someone showed me showing that it's as if the brain is there and there's a wire, an axonal wire around the brain. So it hijacks the functioning. Everything that matters is those drugs. Is to be high. Is to be, you know, these are things that would really, really bring down functionality. So the same way the child's grade would drop in school, the husband starts in his functionality at home, it drops. At work, it drops. His relationship with people drops. So these are the type of
the interaction.
Yes. Someone that is very, very, you know, humble and would greet is now becoming so wild and disrespectful. You know, these are simple, simple things we should watch out for.
Okay, so let me also add, with respect to the, I came across the meth mouth, or the mouth meth, the meth mouth.
Okay.
Now, the effects you can see in the mouth of people who are addicted to this Mkpuru-mmiri, methamphetamine, number one, it changes the color of their teeth.
Yeah.
Okay, it changes the color of their teeth. Over time, it begins to damage. You can see a picture we have on the screen. It begins to damage the gum. Such a person will start having all sorts of dental problems, gingivitis, receding gums, discoloration of the teeth. So when you begin to see this in any individual, please, you should watch out. These are some of the destructions that it can do to the mouth. And of course, if these things are not treated, the person can lose the entire dentition, and then the person will have to resort to dentures. So when you start seeing some of these things, you should be worried. These are danger signs. Okay, these are some of the things that can happen in individuals who are taking to some of these illicit drugs. Precisely, the methamphetamine. It can do this degree of havoc to our dental, to our dentition. Okay, so we need to know that. Okay, so continue. Now, talking about the long-term effects, weight loss, depression, and what have you. Now, how do you make, what are the things, I'm not going to diagnosis just yet, what are some of the things that when we see among people around us, and then we should start thinking of raising an alarm that what could be going on with this individual?
Well, it's a whole lot of things. Like I said, decline. Relationship, as a married man, as a married, you know, in your spouse. Relationship, your functionality at work. Health, medical care. Getting involved in so much law enforcement agency. Economic-wise, this person has become perpetually broke now. However, substances like Mkpuru-mmiri that are cheap, they might still have some money with them. So it's about watching out for decline and in functionality, abnormal behavior. Those are simple things when you see happening that you must watch out for. Like you have showed us about dental complications. These are things that we should just, what's happening in this young man? What is happening in this young boy? So these are things that I would want us to look out for. You know, and
there's a question that is agitating my mind.
Okay.
How did we get here? Where are those things gotten from? How did we get here? Where are they being sourced from? Are they being locally produced?
They're from clandestine labs all around you. You'll be shocked that maybe the next house to you, they produce these things there.
So the precursor, the raw materials, where are they getting it from?
It's everywhere. Just heard that video talking about pseudoephedrine that's used in cough syrup.
Because I also read that they cook it. Is there anything like that? And then in trying to cook it, they add some other street drugs, they mix it, and then it's not the original methamphetamine you have at the end of the day. So you probably they may create another monster out of the monster.
Definitely, because they want it to keep coming. it becomes an highly addictive substance. So so because they want money, just for economic reasons they are doing this. There's no other reason. So they add so many things to it to make it very potent, very addictive. And of course, it becomes very, very psychogenic. And people just break down abnormal behavior, they just miss it. So some people are thinking only of economic reasons. Well, that's how we got here. And there are ways to get out of it.
Are they being imported from any part of the world?
They are made in labs in Nigeria. The raw materials might be sourced from anywhere all over the world.
Okay.
But those combinations, they are made in very secretive labs.
Let me stop you a bit. Duke from Lagos. Duke, good morning. You want to Health Matta? Are you there? Okay. Okay, he's gone. Now, for people who may be around, people who are taking this methamphetamine, I know with respect to cigarette smoking, we talk about second-hand smokers. Are there anything like that? Is there anything like second-hand smokers with respect to methamphetamine? And then if there are, can you also affect them that much as they affect the people who are indulging in it? Well,
I've not read anything. You know, for me, science takes the lead.
Okay.
I've not read anything about second-hand smoking concerning methamphetamine. So I won't be able to say yes or no to that. But leave second-hand smoking. How about the violence that comes from those people? How about the irrational behavior? Because it's the person closest to them that they will first attack. So it's second-hand smoking might not be something that's available now. But what about those other irrational behavior and the aftermath to the family, to the people around them?
Now, when these people get to hospitals, how is the diagnosis made? I want us to go to diagnosis now. Is it their urine that we need to take or their blood sample? Well, or do we need to send them for imaging investigations?
Imagine. Well, of course, the first thing is history taking.
Okay.
What have we been using and the rest like that.
What if they deny?
They will do a lab test.
Okay.
Well, the basic screening test is just a urine test.
Okay.
And it's a simple test that people can do. And that brings me to what I've always wanted, that there should be like a primary health care services, pathway to care. Private hospitals should be doing this routinely. They should encourage, even when people come, can we do urine toxicology? It's a simple test.
Because I read somewhere that schools are now employing the use of urine toxicology to screen their students randomly. They don't give them any sign. You can just be someone, the principal wants you to be in his office, and they will take your urine sample and then test for that. Okay, how good is that?
Okay. It is not the testing that's the problem for me. Okay. What do you do afterwards?
Okay.
Expelling students out of school is totally no for me.
On account of that?
On account of that. Because I will tell you that if you're expelling that guy because of positive cannabis or amphetamine, you, the principal, when you were in school, didn't you smoke cigarettes? Didn't you take alcohol when you were in school? So it can't be a basis. So testing them and sending them for treatment, I mean, there are brief interventions schools could adopt. You don't send a child out of school because, in fact, even because he has used this. Give him a chance, send him for treatment. There should be school counselors, there should be psychologists in those schools that could do some form of brief intervention for those children. You don't send a child out of university because he has malaria. You don't expel a child because he is diabetic. You don't expel a child because he's hypertensive. So why send why send a child out of school because he has substance use problems?
And they are just like this other...
Yes, it's an ICD-10 diagnosis. It is a diagnosis. And I get annoyed when why? I was caught with it. And then the next thing is for a year. And you're destroying people's lives. They've expelled... And for every child you send out there, it's coming back.
Now, what should be the advice for our policy makers, community leaders? Some of them have resorted to the use of force in trying to correct and then their own methods of rehabilitating now, in quote, rehabilitate these addicts in our different communities. What do you have to tell them? Okay. What should be your advice to them? What should be the way forward, or is it just to apprehend these individuals and hand them over to NDLEA officials? Would that be enough?
Okay, thank you very much. When we talk about addiction, it's a specialized field in medicine, and that means it's a form of illness.
Okay.
And when we're thinking about prevention, you're thinking about demand and supply. When there's no demand, there won't be supply. If you think about universal prevention, you think about preventing everybody. If you think about selective prevention, people that are at risk, what do we do to them? People that are now sick, what do we do to them? When we look at it from that point of view, then policies come to place. You know, I was thinking about school. Let's take school as an example. It's a very great way of preventing people starting at all. The most potent treatment to not having complications is not starting.
Okay.
How do we prevent not starting? That's the first thing we should think about. You know, I've read books about Kamala Harris, the Vice President of US, and we saw that when she was, I think, the DA of California, he said she made it a law that not going to school becomes a crime. I mean, everybody is forced. I don't mean university level. Maybe even to DSS, then you can do your vocation afterward. At least you all go to school. You have knowledge. You can question when you give me something. You can develop my logical thinking. When in states where a 5-year-old can be sent to go and buy cigarettes, can be sent to go and buy alcohol, you think the guy won't try it one day? There should be policies in place to help children. There should be policies in place to help the public. When the next building to a school is a brothel, in places, so what do you expect? There should be laws to guiding against such things. There should be laws about age at which you can start use. That you can't use even the illicit ones. There should be laws.
That's the legal ones.
Even the legal ones. The legal ones.
Now, with the high number of people, that are into this addiction, do we have facilities around Nigeria or some other African countries? Do we have facilities where these individuals can be sent for behavioral therapy and what have you? Because oftentimes I read and I hear people talk about the fact that there is no treatment for substance abuse, Mkpuru-mmiri or whatever, that there is no treatment. How true is that?
There is treatment.
Okay.
And at this point in time, let me talk about greetings from my MD, Federal Psychiatric Hospital, Dr. Jumoke Koyejo.
Okay.
And greetings from the Society of Substance Use Professionals, the president, Dr. Martin Zagogo. And this is a society of experts that are into substance use prevention, treatment, and rehabilitation. So there's treatment for it. We shouldn't, you know, when information is what we need. And I really wish we could make use of this medium to actually explain to people that there's treatment and there's evidence-based treatment. So you don't just go looking for treatment in wrong places, where they will write, treat your addiction here, or something funny like that. We could, you know, I wish people could get across to us, even through this program, and ask for places, evidence-based treatment centers all over Nigeria.
Okay.
There are, and people get treated. But even before that, why not talk about more of prevention?
Yes, prevention.
Early intervention. You know, during my ward rounds, and my colleagues say, Dr. K, this patient is really bad. I'll tell you that is why you are an expert. The bad patient should come to us because we are specialized, we are highly trained in that. But before, we don't want everybody to get bad before they get. And the pathway to care in Nigeria is private hospitals. Okay. Those primary health care centers, why not train them?
Because in Lagos, they constitute about 70 to 75% of the healthcare organ that we have. So
if we empower that, let's even make it 70.
Okay.
That's 70%. That means before people get to the tertiary institutions, they would have visited one private hospital or the other. So now imagine people can just walk in and have some form of intervention in those private hospitals. A whole lot will be taken care of, and they don't have to get to the level of complications. And that's and I really want to encourage people. Well, ISOP, and in collaboration with Health Matters, and we're trying to. Well, the program we are designing, it's free for private. We want to do a pilot in Lagos State. I told you about
pilot scheme.
Yeah, that let us train private hospitals, the nurses and doctors in private hospitals, and let's see how much they can do in place of assessment and brief intervention.
Okay.
And they can profile the patient and say,
more like first responders.
Yes, as first responders.
Okay.
And you'll be shocked how much these people can achieve. It has been proven to work. Evidence has shown that it works everywhere. So that means parents can, when they see their child misbehaving, can say, let's go to Grace Valley.
Yeah, you're correct.
Grace Valley, and let us go and test what is happening to this child. Because it seems there's something wrong. And they say, okay, this is what is wrong. And you start doing the brief intervention, brief counseling. And the patient gets fine and goes back. That means you stopped that person from that pathway to complications. At the end of the day, I can tell you that maybe 70% of the problem will be solved. I really wish we could do that pilot. I told you about it.
Yes, it's doable. It's doable. Now, but talking about prevention, I'm also looking at what government can do. There are levels. There should be levels of intervention.
Yes.
What government can do in trying to limit the supply, cut off the supply of these illicit drugs to the final users. Because I believe that a number of people, sources that are peddling it, that are pouring it into the society just for the economical reasons.
Yes.
And I do know that a good number of them may not even indulge in them. They don't use them. They are just making a kill out of it while destroying lives. Mrs. Enoch, good morning.
Good morning, doctor.
Yeah, good morning, ma. Glad to be with you. Okay. Yeah, thank you very much, ma.
My question goes like this.
Okay.
It's not the question I want to ask is that I have someone like that, a child like that, and when you brought the child to the hospital, they will advise you that the child should go through data.
To go to where?
It should go through data, the one they call data 6 months.
Okay, okay.
Drug abuse treatment.
Having that issue of taking the substance.
Okay.
Hello, are you hearing me?
Yes, we can hear you, ma.
So they will advise you that the child should go through the data. But what surprised me is that after going through that data for 6 months, the child will still go back to it. So please, what is the advice?
Okay.
Yeah, thank you very much. Yes, you can treat the question.
Thank you very much, ma. Substance use disorder is a chronic relapsing illness.
Wow.
So that is why you don't get there. That is, prevention is better than cure in this. Just the same with diabetic mellitus. It's a relapsing, it's a chronic illness.
Stays with you, may stay with you for the rest of your life.
So you really have to keep holding on to those things you've been trained not to do. And sometimes the child is not even willing. And I'm not surprised, it's a relapsing illness. Okay, the child made a decision not to use. But when he gets out there, right in front of his house, those substances are being sold.
He has peer group.
Yes.
Some friends.
So when that's indicated prevention, treatment, what policies governs, protects this child that have made that decision? You have made a decision to go to school, but there's no school to go to. I want to go to school, but there's no school to go to. The schools are not functioning. The child, so it is not just about one line of action. It's about all of us coming together, putting in our efforts to make this work. I'll talk about government part of role in this. Policies. I've talked about policies. Even there are prevention for media houses, responsible presentation. As a young girl, when we were growing up, You don't watch all these funny things during the day. Those that want to watch it, you have to stay late at night. Now you can watch anything you want on media at any point in time now.
Okay, doctor, I saw that rat struggling to get the methamphetamine when it was taken off. And that gives an idea of how humans crave for those things. And if they can't get it, they can kill,
Definitely.
they can rob, they can steal just to get the financial power to acquire this thing. What can be the way out of this? Also, going back to the question that that woman asked, we have Joseph from Edo. Good morning, Joseph.
Good morning.
Yeah, how are you today, sir?
I'm doing fine, thank you.
Thank you very much.
Yes. About that substance abuse that you're talking about, I wanted to talk about the diagnosis, how it can easily be noticed, maybe in the hospital or in the laboratory or the sense, so that we'll know the precautions to take. What are the procedures? You talked about producing urine and then looking out for something in the urine. So exactly what do we look out for in the urine?
Thank you very much. Doctor will do justice to it. Over to you, sir.
Good.
Over to you, ma.
Thank you very much, sir. Well, it's a test, the test strip that is being used to test for the presence of the substance in the urine. And this can easily be done by nurses, by doctors in hospitals. So it's a simple test, and that's why there's need to co-opt private hospitals as first responders in this, so that people can easily walk into hospitals and test these children what is happening. And like I said, when you see decline in functioning, change in behavior in children, you might just need to what is happening to this child? This is becoming, it's unexplainable. So you should be able to walk into hospital, the nearest private hospital to you, and do this test. And that's why there's need for collaboration. International Society of Addiction Professionals would be ready to do this, to collaborate, and which Health Matters has actually decided that we should do that collaboration so that first responders can be trained in the community.
Now, thank you very much. Now, in taking it further, this urine test that can be done is just like a strip, in which case you have all the drugs that are common in this environment listed, okay, just like a column. You have that listed, so that when you do the test strip, whatever drug this individual is abusing can easily be indicated. If the person is abusing methamphetamine, the so-called Mkpuru-mmiri, crystal, or whatever, it will show there. If that individual is abusing cocaine, it will show. If he's abusing cannabis, it will show. So it has columns for all of these drugs. Okay. Banjo from Lagos. Good morning, sir.
Yeah, good morning, sir. How are you today?
I'm fine, thank you.
Yeah, thank you very much. You are really doing a great job.
Thank you very much. We appreciate you.
That's a very, very impressive topic. And I would like to make an observation.
Okay.
Because one of the guests that you have there was trying to say something that when you see somebody with drugs or students that engage in original basis for expulsion issues, and he was posing a question that he was going to ask the principal maybe when he was in school, maybe did they smoke, or I think that's not a good way to go about it. That someone smoke or drinks as a principal while I was in school doesn't give other people the right to do the same. And also, it's not everybody that will find a position of authority that does something like that. And I think if we have some reward to the institute, the first thing to do is to call the attention of the parents to it. And the Bible says that if there is no law, there is no punishment.
Okay.
I think it should have been part of the rules and regulation of the school. That if your child is found wanting in this area, after a lot of consultation, calling the parents, coming over, and necessary authorities, if the child remains adamant to that,
Thank you very much. Thank you very much. I think I have an idea of where he's going to, because sometimes the school authorities may feel that having such an individual with other students may be a bad influence. Okay, so thank you very much for your wonderful contributions.